Exercise 21 deals with human reflexes and the physiology involved with that. There are 5 major components of the reflex arc. There are the effect of the receptor, the sensory neuron, the integration center, also known as the association center, the motor neuron, and the effector. So what is happening is in a reflex, a stimulus comes and it activates a receptor, which then activates the sensory neuron, which is, remember, sensory neurons are bringing that stimulus, that information, towards the central nervous system. Once it arrives at the spinal cord, it will stimulate or activate the interneuron. Some information may from there go up to the brain. A lot of it for reflexes will stay in the spinal cord. And then the interneuron stimulates the motor neuron, which is sending the impulse away from the central nervous system, and it is sending it to the effector. The effector is what's going to respond. It may be muscle, which may end up contracting. It may be a gland that ends up secreting sweat or something, or maybe a hormone. But it's going to generate that response then. There are several different reflexes that can be easily tested. Some of these are autonomic reflexes and others are somatic reflexes. Some of the more common somatic reflexes that we can often do in a lab or you can do at home, probably the most common one is the patellar reflex, or commonly referred to as the knee jerk. This is where you're going to take your, usually in a doctor's office, they're going to have the patellar device. It looks like a small little, not true hammer, but where they will tap just below the patella, just below the kneecap on the tendon there. And then in a healthy individual, your leg should jerk out. Just word of warning, if you practice this on someone, do not stand directly in front of them, stand to the side, because the normal reflex is that that leg is going to jerk out. Another one is the calcaneum tendon, where you hold an individual's foot. If they have shoes on, you need to take the shoes off. And then you gently tap on the calcaneum tendon and look for the ankle jerk. Plantar reflex. This is an interesting one because what you would be doing is, once again, on a bare exposed foot, on the bottom or on the sole of the foot, you're going to gently, you can use a pen, gently, just kind of rub along the outer arch of the foot and up across the toes. Now, in an adult, what will happen is the toes tend to flex inward. In an adult, if you get what's known as a Babinski sign, where the toes spread out, that would indicate a slight problem. You should not see that in an adult. It would, you'd want to do further testing to see if there has been some type of damage in the brain. But before you panic, this Babinski sign is normal in newborns. Why is it normal in newborns? Because not all of their nerves have been completely myelinated yet. And so it's still in the formation. So in a newborn, if you rub along the sole of the foot, yes, the toes are going to spread out. In an adult, they should be clenched together. The corneal reflex, this is one I would recommend actually that you not do this. Eye doctors sometimes will do this because this involves gently touching the cornea and seeing the reflex that's going to happen. And when your eye is going to blink, you'll probably get generation of tears, but you don't want to cause any damage or scratching to the cornea. So most people, part of the reflex, as soon as you're coming close to the eye with anything, they're going to blink. The gag reflex, many of you may be familiar with this. If you touch to the side of the uvula, that piece of tissue that's a little hanging down the back of your throat. If you touch that or just to the side of that, that will trigger the gag reflex. Some people, this is much stronger than other people. It's a protective survival mechanism. If you choose to test the gag reflex, just word of warning, like I said, some people it's very strong and they might, we'll just politely say they might regurgitate something that they have recently eaten or drunk. A couple of autonomic reflexes that are fairly easy to test for. The reflex with your pupil, if I can speak. If you shine a light brightly in your eye, you're going to notice that the pupil is going to constrict. It's going to decrease the amount of light that's allowing into the eye. The Celial spinal reflex, this is something some of you may not be familiar with. If you were to pinch along the hairline, the back of the neck, say on the left side, watch and see what the pupil does on the left side. It will probably dilate. It's oftentimes the problem with doing this when testing it is that if the person's anticipating it, they know that it's coming. If they don't, that surprise is going to trigger the sympathetic nervous system, which one of the reflexes of that is that your pupils are going to dilate to allow more light in so you can see very clearly because your body's detecting that you potentially are in danger. Like I said, that one can be a little bit hard to do just because if you're testing reflexes, the person knows it's coming, and so the response is not quite the same. If you were to do it unexpected, I'm sure you get a response, but the person may no longer be your friend afterwards. The salivary reflex, all of us have seen this, where it's kind of that anticipation. You start to taste something, or even before you taste something, if you smell food. If I were to be sitting here and start talking about, oh, a nice crawfish boil with the spices and the corn and the potatoes, and you start thinking about that and imagining the smell of it, or barbecue. And certainly, if you're in the kitchen or you're at, say, a crawfish boil and you're smelling that before you even start eating, you start to salivate in the anticipation for that. Is essentially getting ready for it. So the reflexes, basically the main thing you need to be familiar with is that those 5 steps, you are going to have that initial stimulus to the receptor, which goes to the sensory neuron, which goes to the interneuron, from there to the motor neuron, and finally to the effector.